Welcome to the Healthcare Intelligence Podcast, Dave. I am excited to have you today.
Oh, thank you, Charlene. I'm glad to be here.
Yeah, so one thing that really stood out to me when we were researching your background is you've been spending 4 decades in dental. Is that correct?
Yes, that is correct. Yes, I actually graduated from dental school in 1985. I went to the University of Missouri at Kansas City and practiced dentistry for about 12 years after that.
So from practicing to the business side to PE, like take us through that arc. How was the transition?
Yeah, I mean it's been an interesting transition to say the least. I practiced 12 years clinically, and so I had multiple offices in the Midwest here where I live, and I had offices in Missouri, Kansas, and Nebraska. And after about 12 years, I just really figured out that I had other things that I wanted to do. And technology has always been a love for me. And so I really kind of wanted to sell the offices and then, go into something to do with technology. So that's what I did. I sold them to a family office, a family private equity firm, and then moved and started my own business and did value added reselling of digital radiography and other things to the medical community.
When you were working on technology, I saw you did both the clinical side and a lot in the M&A, private equity, financial side. Can you share a little bit more about what those projects look like? Like what problem were you setting out to solve?
I think in the beginning, when I was working back with private equity, I think the technology that I was using back then would have been more in consulting with private equity. I would have a lot of private equity firms that would ask me to come in and evaluate certain new dental technologies. We could even go back to whenever I worked for Heartland Dental, and I think that's something that you and I have talked about. That the Heartland Dental thing was where they had a AI tool that was called Logicon, and Logicon was basically a came off of a project that the government was working on with Northrop Grumman. It was a secret military project, and it was where they could come in and look at grayscales to identify military targets. And so that particular technology ended up becoming a caries detection program, and that was really how I got into, let's just say, the beginning of the DSO, the dental support arena, and also into more technology in the dental area.
And when you were advising and working with PE-backed platforms and DSOs, I'm sure like there's a lot of scaling pain that you've run into. I would love to hear more about like how you help both the independent group practice owner and also the equity side approach those growing and scaling challenges.
Yeah, so back when I was a CEO of a startup DSO back in 2014, just to give you a little bit of background on that, the playbook for consolidation around dentistry, and I think a lot of healthcare roll-ups back then was really more of a consolidation play as opposed to operationally improving things, the value creation was not as big as it is now. And I think that some of the things that we really tried to do back in 2014, 2015 was most dentists would be on different practice management systems that they would use to do their charting, their financials. And so we tried to standardize and bring our dentists and standardize them on one platform where we could do more controls from the back office for them. So that was probably the biggest thing that we did to try to help consolidate the dental roll-ups that we worked with.
How did you approach change management? I'm sure like there will be some early adopters that's keen for trying out, but there probably are people who like the way things used to be and don't want to change.
Oh, that's a great question, and I will tell you that was probably one of the biggest pain points that we ran into. It's very hard to sell an office that's been using a particular practice management system for years and years, and then tell them that you're going to take that away from them and you're going to bring them something new that eventually is going to be better. It actually has cost us deals in the past where we would be trying to acquire an office, and that would be one of the things we would have to let them know would be that we would be changing a practice management system, and so it's not easy. Change is hard for everyone, I think, regardless of whether it's technology or other things in life, and we found that to be true.
How did you approach like standardization versus like keeping controls locally? Like what do you decide to standardize and what did you decide to keep as in like their own freedom?
I think the biggest thing that we tried to standardize, and again, just to make sure that we're relevant with what's going on today in the DSO arena, they're trying to standardize almost everything now. That's the playbook now, is a lot more operational efficiencies. I think for us, it was really trying to standardize more around the financials and again the practice management. I think we tried to standardize the banking, the capital. I think all of those things that we tried to really standardize. We tried to let we tried to let sorry about that. We tried to let most of the offices continue to run the offices the way that they wanted to from an operational standpoint, and then we would try to give them help where they would ask for it.
When you were looking at bringing in like innovation, one thing we talked a lot about is how dental and Medicare sometimes one is leading, sometimes another one is like what have you seen in the dental space that's like running in front of medical?
Oh, I would say right now, probably the thing that's running in front of medical now, it would be probably in the way that payors come to dentistry. Dentistry really is a cash business now. Dental insurance really hasn't changed over the last 30 years. And so I think when you really look at what drives marketing, what drives consumerism versus dentistry versus medicine, I think that you see that medicine, is basically controlled by insurance, whereas dentistry really is controlled by wants and desires and needs, and people just decide whether or not they want to spend their money on dentistry. And so I really do think that's probably one of the biggest things. Although I do believe that it still holds true that from a technology standpoint, I think dentistry really is about 10 years behind medicine. I think they have caught up with certain things like revenue cycle management. They're definitely using AI right now to do a lot more tasks that they're using agents for. Probably one of the biggest issues that I've seen there is the fact that most of the practice management systems don't talk very nicely or integrate very nicely with a lot of the platforms. So that's going to be probably, I would say, over the next 3 to 5 years, is going to be all the new AIs that come out to help in that regard, is getting them to be able to talk with all the different flavors of practice management.
Yeah, I think this something rings true throughout the years, right? Like it was a almost a table stake when you were looking at acquisition targets years ago, and now technology it's also kind of like a filter on which EMR is the easiest one to work with. One thing that I thought is interesting is one dental actually allowed claim attachment when you're submitting claim, while medical doesn't allow that. We have so many medical partner who was like, "Would just what if we can send that?" So that's not our top denial reason. I just always found that to be refreshing to switch between the different two lane neighbors, but a little different worlds.
Right, absolutely, and that is something that luckily dental has had for a while, is being able to attach to the medical claims, and I really do believe since the days that it's been a long time since I have practiced clinically, and personally had to be worried about claims coming in, but that certainly helped to get claims paid a lot faster in the dental arena, and really helped with that revenue cycle management.
Yeah, and one thing that I would love to get your take on is you also work with many practices, both on the PE backs platform side and the organization side. What are some of the new trends you're seeing this year, 2026?
I think probably some of the biggest trends that we're seeing now again goes back to the looking at the fact that the value creation from a private equity standpoint, they have realized now that it's not a consolidation play. The cost of capital has really changed the game. And so they've realized now to get the recapitalization within the time frame that they want, which standard in dentistry used to be that 5 to 6 year recap range. I think they're learning now that again they're having to put a lot more operational efficiencies into play. They're having to hire much better people to come in and run their companies, and not just people that say the right things and nod their head yes and just agree. They're actually really having to come in and sometimes teach the private equity firms really what they need to be successful and what operational efficiencies do they really need to add. And I really do think that's going to be an improvement in the dental industry. And I think that we're going to see, well, we are seeing that right now. There's been 3 or 4 large DSOs that have gone into receivership here recently, and it's been in the news, so it's not anything that's not out there. But I think we will eventually see a large consolidation too. That some private equity firms will get out of dentistry and say they've learned their lessons. I think some of the bigger ones will continue to pick up more and more groups, and I think we'll just have fewer players, but I think they'll be more educated players.
I think the winner take all probably rings true across the board. Um, what are some of those systems and processes you have seen the leaders put in place that's working well across the groups?
The biggest one right now that I'm seeing in dental again is probably coming across with revenue cycle management. I'm seeing that revenue cycle management is, and I would say this has been going on for at least the last 5 to 6 years, where not only do we have a lot of new vendors that are coming into the market, but I think that we're seeing a lot more advances in the technology that they're able to use. I think that we're also seeing AI being used a lot in radiography again now too. I think there's several companies that have created diagnostic tools that can come in and basically not just look for caries or cavities on the X-rays, but they can diagnose periodontal disease, bone loss. It's just amazing the tools that are available now in dentistry. We've got printing now. I just watched a video yesterday about a person who actually went to China to have their dentistry done. And it was so interesting because the technology that they were using was just unbelievable with the crown printing and the digital radiography, the digital impressioning. And so I think all of that in combination, we're seeing all these new tools that are really making the industry and the profession much better.
I mean, I think with that data and also single, like more concentrated demographic definitely helped with scale. Just building a model that can work for a billion people when launched.
Oh yeah, absolutely, absolutely, and I really do. I think that a lot of people also too don't really understand whenever they do go to the dentist and they go in to have certain procedures done. I think sometimes that they feel like that dentistry is still being done like it was done 10 years ago. I don't think that they realize that really dentistry has advanced so much to the point where you really do have to have a certain amount of technical background now. It used to be you had to know some anatomy, you had to know, obviously some biology, maybe some pharmacology. But I think really to be a dentist nowadays, with CAD CAM and digital printing and all those things we just discussed, you really have to know technology.
Yeah. And I think one thing that I wanted to ask is also we talked a lot about what the more consolidation, more value creation. Is there anything that doesn't scale as well when big players come into the room?
I think probably the thing that doesn't scale as well is, from what I have seen, has been probably in the equity allocation that in the DSOs specifically. That's a big part of the value creation, or what private equity says is that, we'll pay you 60, 70% cash at closing, and then you'll take 30 or 40% in equity. And then your multiple on invested capital, will be whatever X. I think what we're seeing now is, I think, obviously, because the game has changed, I think that we're seeing a lot of those where that promise of the scaling up of what that was going to be for the doctors, not only has it become less, but in some cases it's become zero. And I think that's been a real problem. And I think that there's going to have to be a lot of damage control done to take place for a lot of those instances where doctors were promised, a big second bite of the apple, and now, that didn't come true. So I think that's something where obviously the industry and private equity will certainly need to do a better job.
Yep. And the other thing I also wanted to ask is also, I know like AI has not just been used in the office or the practice, it's probably approaching the changing the way we do deals as well. So we'd love to hear more about how that has changed the way you do due diligence and M&A.
Yeah, well, I'm glad you asked, because that's really what I've been working on. Again, whenever I left clinical dentistry, after I worked with Heartland and helped them out with their caries detection, their Logicon program, and that's really when I got interested in the DSOs. Then what I really found is I was really interested more in the acquisition process and consolidation process. So I actually went back to school and got my MBA degree, and decided that I really needed to know a lot more about business myself. Going through and becoming a dentist, most of my courses were, chemistry, biology, and more so in that regards. And so I really wanted to go back and learn a lot more about business. And so I did that. And then I started acquiring practices for different DSOs and private equity firms. And in the beginning, it was really just kind of learning as I went along, and then as I got to become more sophisticated, I learned that, the problem was is that even brokers really didn't know how to apply, adjusted EBITDA and sellers discretionary earnings correctly. So I actually built my own tool called PracticeWorth. And so what PracticeWorth does is it's really kind of sets between what the free calculators, where you can go in and give them a little bit of information online, and they'll spit out a number, and the number's not very accurate. Or you could call up a broker or a CPA and get a full valuation that could be in the, $5,000 to $10,000 range. And so I built PracticeWorth really to kind of set in that middle place where a doctor could come in, put their P&L in, they can put their collections by provider in. So that's really all the input the doctor needs to do. And then the tool, the wizard itself, runs the valuation for them. And then it also comes out and prints out a full report and tells them not only what the valuation is, the multiple, the enterprise value, but it also gives them a bunch of things they could work for. Let's say that they're not really wanting to run it just to sell their practice, but maybe they're wanting to do it to improve the financials for their practice. So we built all that in as well too, so they can go in and answer a bunch of questions. We've got 20 questions that they can answer to go through, and basically describes the risks that they're willing to assume, the optionalities that they're willing to take on. And so I really hope that, it'll be a tool that will really come in useful for doctors.
Sounds like the accountant should also get a hold of that so they can make sure the numbers are on the right trajectory.
Yeah, exactly too. And we really don't, when I built this tool, I don't want this to be competitive towards, either part of that, consultants or CPAs or whatever. I think the tool that we've built certainly will be of good use for a lot of people, but it won't replace somebody who wants to go in and, let's say that they need to have their practice evaluated for a divorce, or, for some kind of a forensic analysis or whatever that might be. They're still going to need to get a CVA, a CEPA evaluation done. So I don't think it'll ever replace that, but I think,
It will speed up a little bit.
well, yeah, we can get ours done, and I won't promise that everyone can do it in 15 minutes, but I think most people could run through our tool after they've uploaded their P&L and their collections by provider reports and answer the questions. I would say anywhere between 15, maybe 30 minutes tops,
Awesome.
and they could have a 20-page report printed out.
Yeah, it's even less than like a normal cleaning session. So I'm sure people can,
Oh,
yeah, squeeze it
exactly.
in their busy schedule.
Exactly. That's a great. I think I might put that on my website. It's.
Feel free to take it. Yeah.
Appreciate that.
Any final advice you would like to share with fellow operators in the DSL industry?
I just think that we're really living in a really special time right now. I mean, I'm certainly not young by any means, but I mean, I am just really embracing AI right now. I'm just really getting involved in, Claude is my flavor that I like, and I was really enjoying using the Fable 5 until they.
Oh, until it went away. Hope it
Yeah.
comes back very soon.
Yeah, well, hopefully it does. But I would just say that that's really what I would say is just, never stop learning. I mean, life's too fun and too exciting that, there's always new things we can learn about. And you can teach an old dog new tricks,
Always.
always.
Yeah. Love it. Well, Dave, thank you for joining us today. I'm sure we'll catch up very soon, but appreciate your insights, and I'm excited to share that with everyone now.
Okay. Well, thank you so much, Charlene, too. It's been a pleasure to be on with you today.
Awesome.